Dr. Melnick, as patients, we sometimes are running around and we have a missing tooth or two or three or four in our mouth. Usually we have them in the back of our mouth because if they do come in front, obviously we run to a dentist rather fast because, well, it looks ugly. But in the back, we sometimes don't pay attention to it, and frankly, it looks like to us patients that not much is happening. It's not really all that devastating. And yet dentists keep telling us you've got to replace those missing teeth. Can you shed some light on of what this discrepancy is all about? I mean, why do we not really feel all that bad about it, and yet it can be quite devastating?
Well, absolutely. Recent studies show that the more teeth that people are missing, the shorter average lifespan. And the thinking behind that is that when you start to lose more and more teeth, what you do lose is chewing efficiency. So that means that when you are eating a meal and you're grinding your food doesn't get ground up small enough, and you're swallowing food pieces that are larger than they should be. As they work their way through the digestive process, it becomes more and more difficult for nutrients to be properly absorbed into the body. So it can lead to a number of GI symptoms, as well as deprive the body of needed nutrients.
I see. And what about, what is there to it, to the fact that apparently when you have missing teeth, easier than if you not have missing teeth, the teeth in the mouth basically get out of alignment. So a little bit like I'm coming from a machinery engineering background, cogwheels not aligning anymore, and it creates havoc all the way down to a crashing halt. And is there some truth to it that if that happens, a person could get headaches, a person could get neck pains, muscle pains, and you know, by doing so deprives himself of sleep, has less attention span during the day of working, and then literally may make less money because, I don't know, I never really had a chronic long-term headache. I don't know what it is, but I can assume that it wouldn't do me all that good working all day long with one. Is there something to that, a theory, rumor, or whatever it may be?
Absolutely. Let me focus on two parts of what you just brought up. The first part is the quality of life issues, things like headaches and the like. When you start to lose teeth, the remaining teeth in the mouth can start shifting. And when it does so, when you bite down, it can alter the way your upper and lower jaws meet. And this can cause the muscles that control the opening and closing of the jaws to become strained. And muscle strain shows up as pain. So I see many people that have been subject to several tooth extractions. Their bite is now overclosed, so that when they bite together, their front, upper, and lower teeth overlap significantly. The muscles get strained, and they wind up with recurrent headaches. I have some patients that have a headache every day of their lives. It can cause pain in the jaw joints. It can cause noises in the jaw joints. It can cause a variety of ear symptoms. It can cause, again, loss of feeling in the fingers. So there's a whole slew of quality of life issues that can be brought about by significant tooth loss. The other issue that you talked about was airway. We have a number of people that are having difficulty breathing when they sleep because of a closed airway. And if you do lose your back teeth and your bite is overclosed, it does tend to contribute to obstructing the airway. And there's a condition known as obstructive sleep apnea that, if it's untreated, can have a tremendous strain on the body, increasing the risk of heart attack, stroke, cardiovascular disease. In essence, it will shorten one's lifespan. So people need to understand that years ago, there's an old saying, what happens in Vegas stays in Vegas. Well, that's not true of the mouth. We used to think that what happened in the mouth was only a local problem. We now understand that there is a mouth-body connection. And as we get more sophisticated in our understanding of medicine, we're finding that that mouth-body connection is not just a relationship to the quality of somebody's health and well-being, but the longevity of their health and well-being too.
Well, it makes, of course, a lot of sense because our body, is, be it complicated or simple, be it whatever we want to call our body, but it's definitely interconnected. And if having crooked feet can affect your knees and your back and your shoulder, then why wouldn't a crooked mouth, be able to do so? It just makes an awful lots of sense. So what I didn't know here is that missing back teeth actually can cause sleep apnea. So it's not just that a dentist can fix sleep apnea, but actually the dental work in the first place, or the state of the teeth, can contribute to causing it. Is that what you're saying?
Yes, it can.
Unbelievable.
Absolutely. Yeah.
Unbelievable. So would you suggest that, let's just say a person who has, a little more headaches than he wants to, and all kinds of like tension in the shoulders every so often, and he might or might not have missing teeth, because teeth can go out of alignment even if they're all in it, right?
Well, that's true. Or people can be born with misaligned jaws. They could have a skeletal malocclusion, meaning a bad bite, and they were born that way. It's nobody's fault. It's just the way they were born.
I got it. So either way, so a person has these symptoms of headache and neck pain and general, discomfort in that whole area up there. Would it be wise for him to go and say, I've tried other things. Let me go to a dentist and really pay attention to it. Really tell the dentist, hey, this is what's going on. Do you think it has something to do with the teeth? And let him examine. And if needed, go to 1 or 2 or 3 dentists to make sure that, because not every dentist is as well trained in that area than other dentists, as I understand, to really make sure that A, get it fixed or eliminate it as the cause of those discomfort. Would that be a wise idea to do for people with such a problem?
Well, absolutely. In fact, what often happens is, understand that while most dentists have a small exposure to TMJ or misaligned jaw problems in dental school, the average dentist really doesn't treat this on an ongoing basis. It's only dentists like Dr. Miles and myself that have gone for advanced training in this that have it as part of their practice day in and day out. So we're not specialists, but we have special interest in treating TMJ type problems. And my typical patient is either someone that we figure out has a TMJ problem as part of our routine dental exam, someone who is referred to me, and oftentimes these patients who are referred to me have been to a dozen doctors with recurrent headache problems. And each doctor looks at these patients and examines them from their point of view. And finally, they may wind up at an ENT specialist who looks in their ear, says, no, everything's fine. I think you have a TMJ problem. Go see a dentist. And as I pointed out, most dentists don't treat TMJ. You really need to look for someone that has special interest and treats TMJ as part and parcel of their daily practice.
Well, wonderful, Dr. Melnick. And I think one of the things we can get out of here is that, and we all know that, we just don't pay enough attention to it, is that wherever we have the pain is not necessarily where the problem is. And we should really look around it and look for the cause and the source of it. Dr. Melnick, this was very informative. Thank you very much.
Thank you, Helmut.